For Gordon Belshaw, a day on the golf course is just a normal part of life.
I started caddying at 9 years old, and but you can tell how long ago that was because we got paid 35 cents for 9 holes caddying. We grew up in a small town, and that was the first thing you could do.
But recently, an abnormal problem began to surface: excessive internal bleeding. His days on the greens were quickly replaced with days in the hospital, receiving numerous blood transfusions, then a diagnosis.
I was told on a Monday that I had a serious valve problem that required surgery, and I was surprised and shocked.
It was a malfunction in his aortic valve. For some patients, this could be repaired through open heart surgery, but not everyone is a candidate. Now, a new minimally invasive procedure is giving new hope to patients who were too high risk or were previously considered inoperable.
TAVR stands for TAVR, which is transcatheter aortic valve replacement. TAVR is essentially a new technology. It's a new way of replacing the aortic valve when it's diseased, when it's stenotic.
This procedure is designed specifically for patients who have calcific aortic stenosis, and that is the valve between the pumping chamber of the heart and the rest of the body does not open normally. These are patients who are elderly patients and they have very calcified aortic valves.
JFK is part of a select group of hospitals in the United States approved to offer this promising new procedure. They were the first heart program in Palm Beach County and the Treasure Coast to perform the TAVR procedure.
Instead of placing the valve in a strut or reasonably solid configuration, the valves are actually little parachutes, and they have 3 little areas where they attach, and they hang down from these 3 attachment points as parachutes. If you imagine they took a cyclone fence or chicken wire and they mounted the valve just the way they would normally mount it on these 3 struts, and they sew it to the side of this collapsible cage. And then we actually take and put that cage in a device and gradually shrink it down so it goes from being the size of about 1 inch to a size of maybe your middle finger, little finger, just a much smaller size. And that allows us to put it either through the apex of the heart, actually make an incision, small incision through the heart or through the leg or even through the skin. And we inflate the valve and stretch it open and stretch open the calcium. So now the valve can function in the open position, and the valve that's inside this little strut serves as a one-way valve, much like the aortic valve is supposed to serve.
The cardiac staff uses a team approach when it comes to performing this life-saving procedure.
If you're a patient and you're referred to us for evaluation for possible TAVR, there's a very detailed and extensive process that goes on before you get the valve. You meet with us in a valve clinic, and when you meet with us, you meet all members of the cardiothoracic team, 2 cardiothoracic surgeons, myself, and another associate of mine who's an interventional cardiologist. 4 doctors will meet with you and assess your situation. We look at all your information, previous heart catheterizations, echocardiograms that you've had, and we may, in most cases, we have to order additional tests on you that include CAT scans, and breathing, lung tests, pulmonary function tests.
It's a collaboration of multiple physician specialties and the hospital specialties. We have 2 cardiac surgeons, we have at least 2 interventional cardiologists. There is an anesthesiologist who may work also as an echocardiographer. I will have an assistant with me who's a certified nurse anesthetist. We have the open heart scrub team there, the perfusion team is there, the cardiac cath lab team is there, and all in all there's 30 to 40 people involved in this procedure.
Most patients are in the hospital for about 4 to 6 days. It's a little bit less than conventional surgery. And that's because we're early on in the process. We're very careful to ensure a good result, to ensure after they leave the hospital they go to a rehabilitation facility or they go home with home nursing in some cases. And these patients are watched very closely from beginning to end. There's definitely less pain involved. These are smaller incisions. This doesn't involve opening the entire sternum. it's either a smaller thoracotomy or it's all done via the groin approach. So patients tolerate the procedure much better from a pain perspective.
Only selected places within the United States of America that were really had experience, both surgeons and interventional cardiologists, in performing very high complexity procedures. So based on that, there were very tight requirements to qualify for that, and we are one of the centers from South Florida that was selected among only 120 initially in the United States.
This team approach in the operating room is similar to Gordon's days on the golf course. The caddy doesn't just carry the clubs, he plays an intricate part of the team on the green.
The surgeons and everybody involved was great. A couple of them, were just outstanding, personable people. And Dr. Norris is amazingly capable and personable himself, but they were all involved. And the PA surgeon was involved. They were all in there.
They even called and gave us updates during surgery as he had several studies or additional tests done before he actually went under the knife. So it was extremely helpful to have updates from OR to let us know when the TAVR was put in place, that it went well, and very shortly after that, then out came the surgical team and all smiles, so it couldn't have been better.
The next thing I want to do is get back to my golf game and repair it a little bit. I haven't played since October because of the blood problems. And but to anyone my age that's had heart surgery, I would recommend this in a minute.
For more information on the TAVR procedure, contact the JFK Valve Institute at 561-54-VALVE or ask your doctor for a referral.